Hello, my name is Rebecca Hancock, and I'm a Patient Safety and Quality Advisor for the Indiana Hospital Association. Today I have with me Karin Kennedy, who is the Vice President of the Patient Safety Center here at Indiana Hospital Association. We're going to share her patient story and narrative about her journey in substance care. And I want you to note what went well for the patients and caregivers in this scenario. What symptoms improvements have you already made that would have prevented some of these omissions in care? Were there any patient, caregiver, or staff needs or expectations that went unmet? What we know is that unmet expectations can create frustration. And the only way we can sometimes know those expectations is to ask the patient and family through patient and family engagement. Did you hear any omissions that may have affected the trajectory of this illness that we could improve upon? And did you hear any individual or system opportunities that may have been suggested in this scenario of care? Karin, please share with us your story.
Thank you, Becky, for this opportunity. When I wrote this narrative, I wrote it from the perspective of a daughter and what I saw as my mom's health started to decline. So my mom, she actually lived alone since the early 1990s. She was always known to take her medications faithfully, prescribed by her physician or physicians. But I will have to admit that she was very stubborn and avoided medical tests that could lead to surgery or an extended illness of some sort. And her physician knew that. As time went on and as we got closer to, we were into 2016, she would regularly tell her physician, myself, other family, friends, and neighbors that she was fine. I was starting to provide more care to my mother and really was assuming more and more caregiver support over the past 2 years. And when I mean the 2 years, it would be like from 2014 up until 2016, when her care really took a nosedive quickly. At that time, her physician did a really excellent job of managing her care and keeping my mom at home. There was a noticeable change mid-September of 2016 when my mom's health was declining and she started seeing her doctor more frequently. For the past 2 years, I never missed a doctor's appointment with my mom, so I was very actively engaged. I knew everything about my mom's health conditions. I spoke to my mom's physician regularly, but her physician knew that my mom wanted to avoid hospitalization, so she really did everything that she could possibly do to manage my mom's congestive heart failure, her atrial fibrillation and COPD conditions. And also she had a thyroid issue. But my mom had started seeing the physician more frequently. And after several weeks of close monitoring, my mom's physician said that she needed to be admitted into the hospital. And at that time, the doctor really was that she was going to go in for what she referred to as a tune-up. But after 6 days in the hospital, my mom was released to a skilled nursing facility, which was supposed to be a short-term stay. And the goal was that my mom was to return home. So today I'm going to just share with you some details and insights of our journey. So my mom's scheduled discharge was set for Tuesday. After being in the hospital for 6 days and being transferred to 3 hospital rooms, she was ready to leave. But before she could leave, she needed to address one issue, and that was that her magnesium was low. My brothers and I waited as our mom was given magnesium through an IV. Late that afternoon, we were still waiting to leave the hospital. Being engaged and wanting to make sure that my mom's transfer was as smooth as possible, I approached the nurse's station and asked if we could go over the discharge instructions. There were just a few questions that I had. Did they have her primary care physician listed as following her at the nursing home? Were there any signs or symptoms that I needed to watch for? Were there any high-risk medications? Could we review her medication list? Were there any follow-up appointments? And was there anything else that we needed to know about my mom's condition or anything we needed to do to finalize before leaving the hospital? And then I also wanted to know, what was her treatment plan for a hospital-acquired pressure ulcer, because this was something that had been identified on a Saturday afternoon, and as of Tuesday, when we were getting ready to leave, there had been no treatment given. As I approached the nurse's station and I asked, can we please go over the discharge plan? And the transition to the skilled nursing facility, the response from the nurse really made my jaw drop. The nurse looked at me and said, "I don't have to go over anything with you." I thought I actually misunderstood her, so I replied, "I don't understand. I have questions about my mother's discharge plan." The nurse held up a folder and said to me, "I've communicated to the nursing home, and everything about your mother is in this folder. I don't have to review it with you and your mother." And I was like, wow. And that was really the end of it. And so I walked away, went back to my mom's room, and then we got ready to leave the hospital, and the same nurse approached us and said, "Where's your mom's portable oxygen tank?" No one had told us that we needed to bring her portable oxygen tank from home. Finally, at 8:30 p.m., we arrived at the skilled nursing facility. In the days to come, we learned that there was no mention of a pressure sore in the records. She was being followed by the skilled nursing facility until a nurse questioned why I was asking about my mom's primary care physician being notified about her constipation. I learned about doctor's appointments that required transportation on the day of the appointment. She was diagnosed with a urinary tract infection, and she also had a fall. For 24 days, I watched my mom decline and become more and more confused and agitated. We were told that she was depressed, and there was probably some truth to that. However, I kept trying to tell individuals, "This is not my mother, something else is wrong." Her fluids continued to be restricted due to the congestive heart failure, and my mom followed the fluid restriction orders, but she was drinking very, very little. I even asked the question, shouldn't we be tracking a minimum amount of fluid? On day 24, she was transferred back to the hospital with an adverse drug reaction, possible pneumonia, and mild dehydration. As the ER physician asked questions, I learned that there were signs and symptoms that could have been recognized sooner. Unfortunately, this was not communicated to us. My mom's roller coaster ride continued through November and into December. She was hospitalized a third time. After the third hospitalization, the physicians had a conference, and they decided that they would let my mom go into the inpatient rehab program, even though she really didn't meet the full criteria that a usual inpatient rehab patient would have. They wanted really to give her a chance and monitor her, let her have rehab, and continue to adjust her medications. And we were really grateful for this opportunity. It was an outstanding experience. She showed progress, and our COPD, heart failure, and atrial fibrillation were under control. She was progressing with rehab and becoming stronger. On the final day of rehab, my mom left the hospital, smiled, and said, "Cha-ching, I'm out of here." It was a great day. We left and we drove to the extended care facility where my mom was eager to continue physical and occupational therapy. We arrived and the nurse did her initial assessment. She said that the medications were ordered and knew that my mom needed her evening medications immediately. An hour went by, 2 hours went by, and then there was a shift change. The night nurse explained there was an issue and her medications didn't get ordered. We waited and waited. We were told the medications would arrive at 1 a.m. from Indianapolis. Missing not only her evening medications, but also her bedtime medications was horrible. My mom's heart rate went up to 188, and she started having breathing problems. She became very anxious. I try not to show it, but I too was very anxious and frankly angry. I felt like everything that the hospital had corrected seemed to unravel within hours. All that hard work that the inpatient rehab program did was just out the door. At 3:30 a.m., the nurse arrived with my mom's medications, and I looked down and I recognized the pharmacy name and I recognized the pharmacy's location. And then that's when I became confused, and I asked, I thought that the medications were being delivered from Indianapolis. I was wrong. In fact, someone drove from Indianapolis to a local pharmacy that was 2 miles away from the facility. We had been waiting for a driver from Indianapolis, and I was told that it must be done this way because of a pharmacy contract. And really to this day, 3 years later, I'm still perplexed about this inefficiency, which in my mind is poor quality of care. So 3 days after leaving the hospital rehab unit, things didn't progress well at all. And unfortunately, my mom was transferred back to the hospital. And this time we learned in ER that the diagnosis was sepsis. So 4 days after leaving the rehab unit, she was placed in hospice care. And 7 days after leaving the rehab unit, saying, "Cha-ching, I'm out of here," she passed away.
Gosh, Karin, thank you for sharing that story with us. I know it was a difficult time period, and what we've asked people to do is to consider, when you hear this narrative about what really happened, to pay attention to caregivers' words so that we are attentive and listening to what the perceived needs are of the caregiver on behalf of the patient. But from this content over the last couple of years, we've identified several areas for opportunities of improvement, and many of these have been put in place within the system that we're aware of. So Karin, share with us the opportunities that you've identified and that we feel like are well into place.
I think that, the kind of going back to the beginning of the story, I say my mom's health was declining. I knew that. I think really deep down my mom knew that. My brothers knew that. But there was really no advanced care planning. My mom, she thought she was going to live forever. So I know that for her, that's a very difficult conversation. But as I was taking my mom to the physician appointments and to the specialists, there really was no conversations on advanced care planning and really understanding the progression of what COPD does on your lungs and how that impacts, the heart. How does that then impact the issues with the thyroid issues that she was having, and really have that conversation that at some point maybe we could have maybe have avoided some of that and maybe have let my mom go home earlier. So that's, I think, the first thing. And I do know that a lot of good work is going on around the state on advanced care planning. A lot of great strides have been made in that area, but I still think it's an area where we can still improve upon. I think secondly is just to have better handoffs. I mean, I still hear similar stories of, having those bad handoffs. I think looking back, that nurse, that was inexcusable. I was there to help. I was there to be that voice to carry on into the skilled rehab facility. And so, to not listen, as you said, that listening factor really still resonates into my mind frequently. I think also then the handoff at the end from the inpatient rehab to the skilled facility happens after 5 p.m. And so those late after 5 p.m. transitions or transfers, or I'd also say, Becky, too, it's just those transfers that are happening maybe at shift change. It really puts the patient more at risk for whatever reason. And I know that, until that person gets to the skilled rehab facility, they can't really, they can't get the meds there because they have to get, the new physician orders. But they were completely not prepared when my mom arrived. It had been a planned discharge to this facility. So there was plenty of time to plan and have medications, if anything, on standby. That listening component still, I think, is so important, Becky. I think, there were times when I said, "This is not my mother. Something else is wrong." I wasn't heard. And for instance, there was a time where I showed a picture. When my mom had been at that first skilled rehab facility, she was the only resident that dressed up for Halloween to pass out candy. And so I had a picture of her, and I tried to show one time one of her specialists that picture, and immediately like, "Why are you taking pictures of your mother?" And I'm like, "I'm just trying to tell you that not too long ago, this is how she was progressing in that skilled rehab, and something had happened. Something changed. She was on the course of going home." And then I think, also the fact, and tying this into Sepsis Awareness Month, is the fact that my mom went to the hospital for a tune-up, had no infection, and at some point she got an acquired infection that was not in the from the community. At some point, because she was never at home, got that infection. Her body, her immune system had been compromised so much over that course of 3 months that her body could not fight anymore. And so she immediately went into septic shock. There was a delay to treatment. I had gotten a call at 8:30, and she had left me a voicemail saying, something's wrong with my heart, come quick. And so by the time I got to the skilled nursing facility, they were still trying to assess her, and it was a new nurse still in training, and the other nurse was not coming in quickly to help. So there was a delay of treatment, but once that seasoned nurse came in, immediately picked up on symptoms, suspected her liver was failing, called for the ambulance, but by the time all that transfer happened and got to the hospital again, 3 hours had passed. So when you think, about the time of treatment for sepsis, her time zero and that first 3 hours that is so critical was already passed.
And one thing that you mentioned was your mom's pre-existing pneumonia and urinary tract infections, and the fact that now we're encouraging hospitals to make sure they're doing oral care 4 times a day after each meal and at dinner to prevent pneumonia turning into, for the patient to get hospital-acquired pneumonia. So I think that's an important intervention that we're encouraging hospitals to do, as well as the urgency and vigilance around the potential for a new or worsening infection such as sepsis as it progresses. So, and also the need for teamwork as we educate our younger staff, and so that we're all on the same page together for the benefit of the patient, knowing that sepsis is as timely as an emergency as it is for acute MI, myocardial infarction, heart attacks, as well as for strokes. And we want to encourage everyone to get to that point. So Karin, thank you so much for sharing your story. We hope that you use these narratives that we're sharing and listening to our patients and caregivers to determine if you have any opportunities for improvement within your healthcare system. What went well, actually, in this story? There are certain parts of things that did go well. We know the rehab was an excellent opportunity and to provide time for healing. But did you hear of any omissions in care that affected the trajectory of her illness that could have been different? And any individual or system opportunities that you see that may be able to be improved in your system. So use this content to identify opportunities for improvement in your own system. And we thank you so much for listening to our Sepsis Awareness podcast today.